Hey guys, I'm Dr. Paul Lynch. I'm an anesthesiologist and pain management doctor from Scottsdale, Arizona. Many of you have followed me this year as I went to New York when COVID first hit. I guess I should say last year. I went to New York when COVID first hit and then got sick myself. And then I've kind of continued to teach about COVID this year. Many times this year I've said I'm not a Republican, I'm not a Democrat, I'm a doctor. But in today's episode, I actually want to get into politics a little bit. A lot of stuff has gone down the last couple of days, and I just want to start a dialogue the same way I have with my own family at home. And what's going to be exciting about today's show is I've actually brought on a good friend, Luke Wentz, who works with U.S. Global Leadership Coalition and has a background in politics. So as we get into this political conversation, I'm going to have like an expert here that can help us navigate where we're at and where we should be going. So I hope you enjoy today's episode.
Hi, everyone. How are you doing? My name is Austin Hamilton, and I'm with Dr. Paul Lynch today, as well as Luke Wentz. And Dr. Lynch, I've been following you for a long time now during your COVID updates, which you do almost every week.
Yep.
And you've said a number of times that you're not a Republican, you're not a Democrat, you're a doctor. You've been very clear on that message. And with what's been going on lately, you're wanting to kind of come out with a little bit more information on that. And so tell me about what you want to talk about today.
Well, thanks for having me again today, Austin. I appreciate your help producing this for our viewers. This entire year, I've been trying to use my platform to help and educate on COVID. I think that this is a pandemic and a crisis, a healthcare crisis like I've never seen in my career. And so I'm trying to lead on it. And like you said, I've talked about I'm a doctor. I'm not a Republican. I'm not a Democrat. What's happened the last couple of days, I actually want to use this platform today to talk a little bit about politics for the first time. And I think we can, I think about like my children when they ask me questions about what's going on in America, the way I would answer it. I think we can have a conversation about what's going on, what's good, what's bad, and how do we get through this? How do we unite as a country? How do we become stronger? So I do want to touch on a little bit today, but first I do want to review the data on where we're at with COVID because a lot of people have asked me for an update, what's going on and where are we going? So I want to start with that, and then we're going to get a little bit into politics today.
All right, sounds good.
So why don't we jump into the data? And so I talked about this a couple of weeks ago with you. We are hitting the worst days right now, and I talked about on the show before that we were peaking around December 24th. I'm going to get to that in a second. I want you guys and the viewers at home to think about there's 4 levels of data. There's actual cases, like I got a case today. There's the day that it was reported, which could be 10 or 12 or 14 days later. There's hospitalizations, which is usually 2 weeks later, and then there's deaths, which is like 4 weeks later. And so we're going to talk a little bit right now about reported cases. We are the absolute peak right now in the world of reported cases. And so reported cases in the world yesterday was 786,000. That's a new record. And deaths was almost 15,000 deaths, which is also very close to a record. If you look at some of these countries, Brazil reporting 62,000, the United Kingdom 62,000. This is certainly hitting the world really hard. If you can click, and by the way, I always put these links below, but this is worldometers.info. If you click like on Europe, you can see just Europe had 272,000 cases in a day. I like to do a deeper dive on the United States of America. Almost 22 million cases, and Austin, I've told you in the past, a good metric is to triple it. Whatever you see, it's about triple. So there hasn't actually been 21 million cases of coronavirus in the United States. It's more like 60 million. And so we kind of keep an eye on that number. We're not going to have herd immunity until about 70% of the United States or 75% has contracted this, and we don't want that, and that's why we're pushing so hard on the vaccine. We need 70 or 75% to either have got COVID or to get vaccinated. And so we're probably more like 63 million people that have contracted it. This number is just super sad to me. We're up to 370,000 dead as of today, and I've told you on past shows that you can probably multiply that by 1.5 to see the total impact of COVID, either deaths that were unreported or deaths from other causes like suicides, depression, heart attacks at home where people didn't want to go to the hospital, other deaths of stroke or things because the hospital systems are overwhelmed. Look at what's happening in Texas and California right now. We have systems that are literally on the brink of collapse, and people talk about that. We can get into that and further future videos, but probably the real number is well over 500,000 dead at this point, which is quite sad. I want to dig into the data from yesterday in the United States. This is an absolute peak for reporting of cases. And I want to say that again. I'm going to show you guys the peak of actual cases was almost 2 weeks ago, but the reporting of cases now are peaking with 260,000. Now deaths, they truly are peaking right now. And so over the next 5 or 6 days, You're going to see the death rates peak in the United States. I talked about this 2 weeks ago with you, that we would probably hit 4,000 dead in a day, and that would really freak people out. And that happened yesterday. So we had 4,100 reported deaths yesterday, and it happened to occur on a day that was pretty tragic in the United States and what happened in the Capitol. And so today, we're going to try to do a little bit of a deep dive on what's happening politically in the United States and what's happening with COVID in the United States, and are they related? And like, this is going to be a tough conversation, but I just want to point out that the day that we hit over 4,000 dead was the same day that we had tragedies at our Capitol. And so we had 4,100 dead. California alone had over 500 reported deaths in one day. Texas, over 300 reported deaths. This was not a really good day from a reporting perspective. Now, why do I keep saying that from a reporting perspective? I just want the viewers to hear this message that when you turn on the TV, whether it's Fox or CNN or NBC, everyone is freaking out about right now is the worst it's ever been. And there's some truth to that. But from an epidemiological perspective, we actually peaked in the United States in transmission 2 weeks ago. Have you heard this reported at all? Is anyone talking about this on the news?
I haven't.
I haven't either. No one is saying we peaked 2 weeks ago, because it's too hard to explain to people that from a transmission perspective, the very worst days was Christmas Eve. And we talked about it on the show on Christmas Eve. And I just want to show it again. This is the IHME model. You can go to COVID-19healthdata.org, and I'm going to put a link below and look at this. But this is, let's go to transmissions, daily infections. And so this is a model, but they update it daily based on all the information. And if you look at December 24th, the scientists at the IHME have basically tried to estimate how many actual transmissions, not reported data, but actual transmissions. So that's like the person who got sick and stayed at home and never got a test, and the person who got sick and was never symptomatic. They said that there were almost 698,000 people who got COVID on December 24th, and that was the absolute peak. And if you look at it, it's come down, come down, come down, come down. If you go to today, it's more like about 600,000. And so that's like a 15% drop. Now, 600,000 is still a lot of cases, so I'm not saying like everything's fine and dandy, but what I'm saying is we peaked. And if you go back to the Spanish flu, there were 3 peaks. There were 3 waves, right? There was the first wave in the spring, and then in the fall of 1918, there was a massive peak, and then there was another peak. What I'm telling you is we don't think we're going to have a third peak because of the vaccine. So as long as enough Americans hear the message, understand it, trust the science, and get vaccinated, and if we can get everyone vaccinated that wants to get vaccinated by May or June, we're not going to have a third peak. And so it means that we're coming out of this. And so you can kind of start to look at this model. We peaked on December 24th, and then it's coming down. Here's today, 600,000 cases, coming down, 450,000 cases. If you go to March 1st, you're down to 280. Keep in mind, this is about triple what's being reported. So that means we'll still be reporting, maybe 80 or 90,000 cases a day. It's not like everything's great, but it's coming down. We're getting back to life as normal. Once you get out to about April 1st, which is as far out as this model goes, you're down to like 120,000. That means on a daily basis, we'll be reporting 30 or 40,000 cases. It'll be back like September again. And so what I've been telling people is this whole year, hey, it's actually worse than you think. The message today is it's actually not quite as bad as you think. And that's a nuanced message, because if you look at deaths, the deaths still aren't going to peak until next week. And so if you go back up on this IHME model, and I encourage everyone else to look at this for yourself, but our death rates aren't going to peak until about January 11th, and it's going to be averaging around 4,000 a day. And that's a scary number. We're just starting to hit that. I want to point out, if you go back and watch our video from 2 weeks ago, I told everyone we were going to cap out at around 4,000 deaths, and it's exactly what's happening 2 weeks later. Science and numbers can predict the future if you take the time to find the right numbers and the right math and look at the right sources. And so we're right on where we expect it to be. I want to look at Arizona data just very quickly for all of our Arizona viewers here. Another way of looking at the same thing is this is from the Arizona website, and there's a button that you can click on here that says confirmed COVID-19 cases by day. And what the Arizona Department of Health has done, which is really smart, is because of that 1 or 2 week lag sometimes in reporting, when it comes in, they actually show you how many cases there were on the day that it was taken. And that's a smart way to look at it. And so you can see our peak in the summer. I've taught this many, many times, but it was like June 29th. We had over 5,000 cases. That was the first peak. And then it went down, and we were all having a good time and enjoying ourselves. And then we got hit again. But the peak looks like it was December 28th in Arizona. And so keep in mind that model I showed you before was December 24th. That was the entire United States. Arizona peaked slightly later, 3 or 4 days later, according to this data. And if you look right here, December 28th, we had over 10,000 cases in one day. That was actual people on December 28th who got tested. They may not have reported that until yesterday or the day before, but that was a day. So we're still almost 2 weeks out, a week and a half out from the actual peak in Arizona. And I think that's a good thing. So there's a little bit of a message of hope that we are getting through this. We're going to have some bad days and deaths over the next 2 weeks, and then we should start to get better month after month. I'm telling my business when they ask me, like, what are we doing with our clinics and what are we doing with patients? And I'll just tell you, Austin, we're still over 50% of our visits are telehealth. And we do that intentionally to save lives, to protect our patients, to protect our staff, over 50%. But as I'm looking at the spring, I think we start to get back to normal in April, maybe May. Certainly by June, as more and more people get vaccinated, we're going to get back to normal. So that's my update on the data. I want to just tease what you said in the beginning. I think it's time to talk a little bit about politics, right? Because I've avoided it the whole year very intentionally. And the reason I think I changed my mind yesterday was because I realized that politics are beginning to affect our health. And so as a doctor, I may not be an expert on politics, and I don't have to talk about Republicans and Democrats, but I think I can talk about the concept of politics. But I told you yesterday, I'm not the expert on it. Why don't we bring in someone who is an expert? So why don't you introduce our friend Luke?
Yeah, Luke, glad to have you here. Tell us a little bit about yourself.
Thank you very much, Austin. And Paul, thanks for the invitation to join you. Earlier in my career, I ran a congressional office and a congressional campaign. I'm still very involved in the political sphere as doing work for a national foreign policy organization, which I basically like to say we do domestic policy work in the context of foreign policy. And I also run here in Arizona a government relations consulting firm. And I couldn't agree with you more. Today is a day that we need to have this conversation. Yesterday, we saw one of the most devastating things that has happened in this country in a very long time. And it's time to have that conversation because, as Paul said, if we don't address it, it's going to continue to exacerbate and get worse. And let's have the conversation. It's important.
What's going on? And so thank you, by the way, for joining us. Luke and I have been friends for a long time, and I see you helping a lot of people in your kind of approach to politics. What's going on in America right now, and how do we get out of it?
Right. Well, again, Paul, thank you for the invitation. The best way I can put it is all of us saw yesterday when we were having a conversation about COVID, and then there was a conversation about the integrity of the election. The president threw a pretty big rally yesterday as they were going to affirm the electoral college votes, and obviously everybody watched the news and saw the insanity of what happened in our nation's capital yesterday. And it's something that was a great stain on this democratic republic and something we need to be concerned about. But the simple reality is that there is nothing wrong in America that we can't fix by what's right in America. And we need to remember that. We're not Republicans and Democrats. First, the only thing and the most important thing that unites us is that we're Americans. And that's what needs to prevail here. That's the conversation we need to have. And my hope is that as we continue to move forward, that's where we're going to focus.
Austin, I wanted to bring you into this conversation too, because we've talked about some of this. Like, it's not just Republicans and Democrats. Some of this is being fueled by social media, right? Like what are you seeing on social media, and what conversations should we be having?
Totally. Well, right now I'm not seeing a whole lot on social media because I've kind of purged out a lot of the noise over the last year, really. And that's on both sides. So Republicans, Democrats, I have a lot of friends or contacts on Facebook particularly who are very passionate about sharing their opinions. Yeah. And my preference is I just don't want to see that, the polarizing ends of the spectrum, right? I'm okay with seeing the people's opinions here and there, but when it's hateful, which I'm seeing a lot of, it's been an opportunity for me just to unfollow, unfriend people. Right. Yeah. And to be honest, with what happened yesterday, I didn't see a whole lot of noise on my feed because I've gotten rid of those people. Wow. So, you shared a story of a friend who removed their sister or brother as a friend and didn't even have a conversation with them.
It was actually one of the things that made me just decide that I was going to talk about this today is as a physician, I'm seeing unhealthy behavior. Right? Like, I used to always want to be a psychiatrist, and I've actually talked with you about this on shows in the past. Like, my whole life I want to be a psychiatrist. I was a psychology major in college, and I really care about relationships and family. And I was just scrolling yesterday and popped up on my feed a friend who said, one of these really common things on Facebook is like, if you don't agree with this comment, then unfriend me. And then everyone, of course, that causes, triggering for people and, you can unfriend me. And then the person's sister came on and started arguing. And then one of the friends argued with her sister. And then before you knew it, she said, I'm blocking you. I'm unfriending you. Like, to her own sister, like just removed her, and it wasn't like a healthy, like what you're talking about is healthy, is like just remove people that are causing strife. This is someone's family. And I think of that as like a psychologist or as a physician and think, this is where social media is actually fanning the flames, and the dynamic and the way it's set up is ripping people apart and relationships apart. And I think we need to have a conversation like, are Republicans and Democrats really that different? Are blacks and whites in this country really that different? Like, or do we have to use these things, these labels, to rip us apart? Or what did you say to me yesterday when we were talking about it, like the differences in Americans?
Well, I think what's so problematic is that we have to remember that we are Americans first, right? That we what brings us together is so much more powerful than what divides us.
Yeah.
And I think you and I were talking about this. There was a time just 50 years ago where the Venn diagram was a lot closer together, and now they barely touch. And that's a problematic thing. And I think what's happening is as America realizes the problematic reality of this, there's a growing middle that is becoming more and more vocal, that are feeling empowered to talk about this issue. Because as we get the fringe left and the fringe right, people on both sides of the political aisle, one side that thinks that everything that's wrong in America has problems is because of Republicans, and one that thinks everything that's wrong in America is because of Democrats, is hopefully waning. Waning. I like to say that there's this growing middle party that's growing, and you and I have talked about this, that we refer to as the moderate, radical moderates, which I find quite funny. But I think that's growing, and that's important, because we need to realize that after a day like yesterday, where people ramaged through the United States Capitol, one of the most sacred buildings in our land, and showed an
you used to work there, right?
And I used to work there. I worked on the Capitol building. I've been in there 100,000 times, and I continue to go there every year.
Right.
And it was a disgrace, and there's no other way to put it. This was not Antifa. This was not the hardcore left. This was radical conservatives that wanted to make a point, and it was a wrong point to make. And instead of dividing us even more, let's all come together right now and say, hey, we are Americans. This was wrong, and we need to do better collectively.
Let's dig into that concept where you talked about a Venn diagram. So a Venn diagram basically is overlap between dissimilar things, but they show how much similarities there are. There was a chart, and we can probably find it and attach it below in the comments, but that showed 30 or 40 years ago ideologies between Republicans and Democrats and how much overlap there was. And it was like 75 or 80% overlap, where most Americans agree on most things. And then you push that out over time, and you see it spread out and spread out and spread out, where now they don't really touch at all. And it goes a little deeper. If you dig into the social psychology of it, most Republicans now say they don't have many Democratic friends, and most Democrats say they don't really have very many friends that are Republicans, and we're just so divided, and we're doing this to ourselves. The question I have for you, Austin, is why do you think this is happening? Is it media? Is it social media? Like, what's driving this?
Yeah, my point of view on that is it is media, and it's social media also, that people aren't able to have conversations with one another. So I found with a lot of people, I'll see them post things, maybe I'll post something, although I really have stayed on the sideline for the most part this year, but I'll have a lot of judgments or opinions about them, and they may have them about me also. But when we actually get together and have a conversation in person, in real life, we realize, we actually agree on most things, and the things we disagree on are really, okay, fine. We have to disagree on something. We're not the same, right? So I think social media just fuels that fire in an unhealthy way from what I've experienced. And that's why I've just disengaged. What I want social media to be, and maybe this is idealistic, but I want it to be what it used to be. Pictures of dogs, cats, kids, people having a vacation on a lake at the beach. So it's just infiltrated everywhere, and we spend so much time on it that I just think it gets unhealthy from a mental health perspective. And again, that's why I'm totally fine with when people make that call for, if you disagree with this, unfriend me. My point of view on that is, if there's any topic that is so important to you that you don't want to be friends over, great. I have no problem unfriending you. So I do that with great joy. So unfriend.
Austin, I think your approach is very healthy. I can just say, as a physician, I wanted to moderate some of this from a mental health perspective. It's very healthy. I think that your answer, that what's driving this difference between Republicans and Democrats being social media, is evidence-based. And I've looked through it a little bit. Normally, I'll back everything I say up with tons of data, but I think people can do their own research on this, that if you look at the advent of social media, call it 2004, 5, 6, that's when a lot of this started to really happen. And I think that they overlap, for a reason. But I think your approach is healthy, and I think a lot of us need to get more healthy approaches. I wanted to tell a story with you, Luke.
Sure.
I can remember we went to Washington together last year.
Yes.
We worked together on the U.S. Global Leadership Coalition. So Austin, what that is we promote the State Department. So I do a lot of work in Africa, and I want to make sure that we fund work with like the Peace Corps and some of these American refugee committees that we do work in Africa. And I want to make sure that congressmen know the work we're doing and how important it is. And so I can remember walking up the steps of the Capitol and going in and meeting with a Republican congressman and then a Democrat congresswoman, and I felt the same amount of pride in each meeting, and I felt the same amount of like the awe of the moment that I was there meeting with them. But when I look at some of what's happening right now with Republicans, Democrats, I don't think they look across the aisle and feel pride or any sense of the importance of us being Americans. Do you feel that way as well?
Absolutely, Paul. What they feel is disdain for one another. And they feel as if rather than talking to another human being who just may have a couple of perspectives that are different than you, and even if they're significant, what binds us together as Americans should be what prevails. And it's not happening right now. And you're seeing this on social media, Austin. You're seeing it left and right where people are so fueled by their anger that they lack the capacity to even have a rational and reasonable conversation that really is rooted or originated in the fact that we are more alike than we are different. And what happened yesterday was indicative of what would happen in a third world country, and it's something that we should all be incredibly disgusted with. And today we can all do better, and we have to do better because it's not about whether or not you're pro-life or pro-choice, or if you're pro-Second Amendment or think nobody should have guns. Right now, it's about we are Americans. We need to do better. We will do better. Let's move forward together.
So, Austin, I think we could talk about this literally for hours, and I think we can do maybe a follow-up on this over the next couple of weeks. But I think I think that's the message that I wanted to get out there today to people. I want us to start the conversation on how we heal as a nation, how we look across the aisles, whether you're a Republican or a Democrat, that we are more alike than we are different. Right? And I want us to start that conversation. I want to be part of the positive change in America.
Totally. So one question on that. Do you think that with what we've experienced this year with COVID, lockdowns, masks, vaccines, which of course has political implications behind it, do you think that's fueled some of this for people where like yesterday we saw an explosion, unrelated directly to what's been going on, but has that kind of fueled some of it?
Yeah, and I'm glad you asked that. I think that's probably the final kind of question that we'll go over. That one of the reasons I'm speaking out too is I feel like the politics that's dividing us is making us less healthy. And as a doctor, whether we're arguing about hydroxychloroquine or wearing a mask or vaccines, it's becoming a political conversation, and I think it needs to be a healthcare conversation. And so I think, yes, that's part of the reason I'm kind of speaking up to say let's have a little bit of a political conversation is your beliefs, if I'm talking to a patient, like your beliefs about getting vaccinated, if it has to do with your party affiliation, that doesn't make sense to me. If we want to have a conversation about whether you're high risk and whether it's a good option for you, and each each patient should make a decision that's best for them, but it shouldn't be based on their political party. And so, whether it's mental health or whether it's your physical health or whether it's in Washington, what happened yesterday, like actually people dying, like there is a healthcare aspect of what's happening right now in politics. And that's why I just wanted to lightly start this conversation today. Okay, well, I feel like we did some good here today, guys. And I was a little uncomfortable with this. But I think it's important that we start this conversation as Americans first, and we move forward and we make this country more healthy and that we heal, right? So I want to sign off now at this point. Thank you, Luke, for joining us. We'll have you back in the future. Austin, thank you so much for setting this up for us and interviewing us. I just want to tell everyone that's watching, America is an amazing place. We have wonderful people. We have differences. I think we should celebrate our differences, whether we're Republicans or Democrats or black or white or man or woman. Let's celebrate our differences, but let's also celebrate what makes us the same. And we're going to move forward. We are going to continue to grow as a nation, to heal as a nation. If you enjoyed watching this today, whether it was the COVID update I gave at the beginning or this message of politics, share it with your friends. Start conversations with your friends, and make comments below if you have questions or anything we can do. God bless you guys. Stay safe. I'll see you next time.